Well, hey again, Mr. Bleeker here. There's a couple more topics we need to cover in the course. One is the internal and external anatomy of the human female. So, a really great site to go to take a look at aspects of anatomy is zygotebody.com. You'll see it here in the address bar. And as I peel back a few of the layers here, there we go, we can zoom in on female reproductive anatomy. So when you look at the uterus, this is the bladder, so we'll just ignore that. But when you look at the uterus, it's located here, and we talk about the uterus as having sort of a bull-like appearance, horns. So if you visualize this as the head, then the horns are the fallopian tubes leading up to the ovaries. Okay. Now I'm just going to pop out of this diagram for a moment and show you just a simpler one here. It's a little less three-dimensional. So, of course, like we say, we've got the ovaries, and their job is to produce and release the eggs. And right here, it's kind of interesting. The fallopian tubes end in these sort of finger-like projections called fimbriae. And their job is to pick up the egg and waft it using cilia down the fallopian tubes. And often fertilization will happen in the fallopian tubes, but you don't want implantation to. If it does, that's called an ectopic pregnancy. And a fully developing baby in this region would just cause the fallopian tube to burst. And that's critical. Those pregnancies have to be terminated for the survival of the mother. Fertilized egg would come into the uterine area here, and this is where implantation will hopefully happen. Now, in medicine, this is very interesting because where implantation can happen, it can happen in a couple of regions. Some implantations can actually happen up here, to the side. Some can happen down low. And the development of the placenta can become a real problem. For example, if the placenta develops here, the baby can't be delivered through the placenta. A low-lying placenta itself, in many cases, leads to a cesarean section where they externally, if you watch my mouse here, they'll cut kind of with the grain of the skin to reach into the uterus to remove the baby. In a medical scenario like that, the baby just can't be born through the cervix like it would need to be. The cervix down here is the opening, basically, to the uterus in this region. The cervix here itself will have a mucosal plug when the mother is pregnant, and that plug, it will begin to thin and sort of wither away, and at about the time the mother's water breaks, that's when that plug is no longer sealing the uterus. And there's a lot of misnomers about that, where they think the water breaking in the pregnant mother is just like this gush. It's in most cases more like a trickle, right? But it's a sign that a baby's on the way. Leading to the cervix is, of course, the vagina. So when we talk about mammals, if we think back to biology 11, internal fertilization is a strategy amongst mammals to bear offspring internally, so the mother can keep the baby safe inside and run away in the case of danger or any threats faced. It becomes a little harder, obviously, as the pregnancy goes along. That goes without saying. It's a strategy that's different than that of fish, which practice external fertilization, and the babies aren't supported internally, largely. The babies are kind of on their own. One more mention I wanted to point out about the cervix is this is a region where women can get a lot of problems. If you've heard of a pap smear, a portion of the cervix is basically kind of scraped at, and we take the cells off and we check for cancer. Because the cervix undergoes so much mitotic division, the cells are regenerating, that this is a region where cancer can be quite a concern. Not to say that cancer can't be a concern for the uterus or for the ovaries. Of course it can. But this region, you'll find your doctor will keep much more of a sort of an analysis of. And again, that's called the pap smear. Okay. So that really covers it for female reproductive anatomy. That's more or less just the internal. In my next lecture, I'll cover female external anatomy. Thanks.